Our program is a medium-sized program here in Oklahoma City. We're very close to downtown Oklahoma City. At the University of Oklahoma Medical Center, we have about 500 adult beds and all the subspecialties available to us. We also have a very large campus here at the OU Health Sciences Center where we have several colleges, including the College of Pharmacy, the College of Medicine, and the College of Nursing, along with several others. Our program does a really great job at developing highly skilled clinicians while really maintaining a focus on education. We really help you produce scholarly activity that you're interested in and focus on resident wellness because we know how important that is. We want to provide you the skills to be successful in whatever your future career path holds, whether this is to be an outpatient physician, a hospitalist, or any type of subspecialist. We provide you with several opportunities to experience all the subspecialties within internal medicine as you make some of these career choices.
So our culture is a good mix of hardworking, kindness, and like I said, a lot of fun. So every month, at least with our interns, we have social events on a monthly basis just to kind of, blow off some steam between each and every rotation. And then on top of that, no matter what rotation I'm on, whether it's HEMONC or on my wards months, my attendings have been incredibly approachable. All of the upper level residents are very approachable and very kind in helping me, and I think we all have a mutual goal of patient care in mind. And so this is exactly the kind of culture that I was looking for whenever I was looking for residencies, and this place it worked out. It's been perfect.
I think the most surprising thing I found in Oklahoma City was how nice everybody was. And first I thought, oh, people in my program are super nice, and I was like, oh, people in my hospital are super nice. And then having lived here for a long enough time, I was like, everybody in this place is so nice. And on bad days, just a random person smiling and saying hi really makes a big difference.
When I was interviewing for residency, I really wanted to go to a city which was diverse, had an urban lifestyle, had good food options, of course. And when I came here to Oklahoma City, I was particularly surprised. I was blown away. Oklahoma City is a growing and upcoming metro area. It's now the 22nd largest city in the United States. And this place is really unique in the sense that it also offers all the benefits of living in a small town.
My favorite thing about OU's program is probably our autonomy. I feel that in this program, as I've progressed over the years, I've really had the chance to take ownership of my patients and kind of expand my wings and really take care of patients on my own. But I always know that I have a strong safety net there for me. Attendings are available day and night. I've called them many times 3 in the morning without issue, and they're always available.
What I do for fun in Oklahoma City is biking, both mountain and road biking, and I've gotten to spend quite a bit of time each month. The resident teams, as we finish up a rotation, we all try and get together and talk about our experiences and relax a little bit.
Moving to a different country, a different system in a new city, it can be particularly challenging and intimidating. But here at OU, I think I was fortunate to have the support of amazing seniors, friends, and even faculty members.
Oklahoma City is a very cool place to live. One of the things that attracted my wife and I to it is the affordability. We're both residents here at OU, and we're able to comfortably buy a house and go out to eat and do all the things that we enjoy to do when we're not at work. So that was a big plus to come in here. Other things is I felt the city is big enough to offer everything that we want, such as entertainment with concerts or professional sports team and restaurants, but it's not too big that I feel like I get lost in the city and things like that. I don't spend my entire day sitting in traffic.
So I'm originally from Missouri, but we moved here for education and residency. We chose to stay here, my husband and I, because several reasons. First reason is because Oklahoma is a great place to raise a family. Oklahoma City has a lot of things to do. The people are nice here. But I think the main reason we chose to stay is because we knew so many physicians that had come out of this program that just had excellent educations. They're some of the finest physicians that we know of. And the board pastorate here is fantastic.
So the research opportunities at OU are numerous, actually. There is a very good resident research curriculum where there's didactic lectures and just learning about research methodology. That's one piece of the current curriculum. We hope to expand upon this and have journal clubs and increased opportunities for the residents to meet with faculty and mentors as well throughout their time as residents. And then hopefully in coming years, we'll also be adding more and more opportunities for resident research roundtables where we are discussing what residents are up to and what they're interested in, some of the challenges they may be encountering with their particular project, and also expanding a resident research block that we'll be having for the residents.
So I think if you're interested in research, OU has a ton of great opportunities to offer, be it basic science research, clinical or translational research. We have large single and multi-center trials currently underway here at OU, be it in the field of cardiology, rheumatology, or oncology. And we as residents do get to be a part of those trials and get to work with some of the most prominent leaders in the industry.
I'm Lindsay Jones, and I am one of the associate program directors for our residency program, and I also serve as the medical director of the general internal medicine clinics. Our resident clinic serves as the longitudinal clinic where our residents see their patients on a regular basis. They work with an interdisciplinary team that consists of attendings, pharmacists, nurses, and social workers to provide a high level of care for our patients. We have a very diverse patient population that consists of patients with both insurance and uninsured patients, as well as underinsured patients. And we feel very strongly that we should continue to care for those patients, and that is an important patient population to us. We are going to be moving this fall to integrate with the faculty clinic, and I will be the medical director of both of those clinics. We will continue to serve the underserved population of Oklahoma, but we are excited to bring them updated facilities and more resources to provide them with a high level of care. We care for a very similar population of patients in the outpatient and inpatient settings. Those patients are diverse in both their medical complexity and their backgrounds. We take care of many complicated medical problems, but we also see your general internal medicine cases that you will care for frequently throughout your career.
Here, I feel like I can take care of any patient on any day, no matter the circumstance. I think the training was solid. From the diverse subspecialty exposure to the diverse patient population, the complexity that we mentioned earlier, as well as just like a solid training base in general internal medicine, left me able to progress in independent practice without any issues, fearlessly, really. POCUS stands for Point of Care Ultrasound, and it's defined as the clinical integration of ultrasound images at the bedside by the treating physician. Basically, it's used to help improve diagnostics and clinical decision making. The American College of Physicians, one of our governing guideline bodies, recognized the importance of it and wants to expand the use of it in internal medicine. So our program consists of didactics and small groups, hands-on sessions led by faculty members at the bedside throughout the year. It's primarily aimed at the junior residents and senior residents, but interns are more than welcome to join when they get time.
Yeah, so the Global Health and Social Justice Program is a comprehensive program for our residents to learn about health disparities both in our community, locally, as well as abroad. We have a longitudinal educational program for our residents. And during that time, residents learn about access to care, as well as what creates a healthy patient in our community. In addition to that educational program, we have 3 rotations. One is the international rotation that we have in Uganda currently and hope to partner with Mexico in the future. We also have another rotation called the Health Disparities and Advocacy rotation, where residents really learn about what resources exist for our patients in our own community. So during that time, they'll actually get to rotate in several of the free clinics, as well as visit some of our homeless shelters and other resources for our patients. Then our last rotation is the rural health rotation, and during that time, our residents actually go to rural Oklahoma and Tallahena and learn about the resources there. And how to best educate our residents in caring for all types of patients. It's really important that we reflect that in our own residency program. And so along those same lines, we hope to recruit residents from a diverse set of backgrounds so that we really get a breadth of perspectives. And I think it's really helpful to have a diverse set of residents that can all learn from each other because it holds the same principles when we're caring for our patients.
So the new parent elective is a month-long course for new parents of any kind, including adoptive parents, who basically during that month you get to stay home with your new baby or your new child, and all of your clinic is pushed to the end of the month so that you don't have to do clinic during the first three and a half weeks of the month. And in the end, you do have to give a presentation of kind of your independent study or what you've learned during that month, and you present during noon conference.